Not in the shot, am I?
Nope.
Okay. We're live? Good afternoon, everyone. My name is Chip Partner. I'm the Assistant Vice President for Communications at the University of Rochester Medical Center. I'll thank everyone for being available on short notice. We've received multiple questions today from different media outlets about the environmental service workers that do such a great job for our medical center and whether they have the appropriate personal protective equipment to do their jobs. So rather than answer those one by one, we wanted to put together a quick availability. I'm joined by Dr. Mike Apostolakis, who's the Chief Medical Officer of the University of Rochester Medical Center, and Harvey Gamble, who is the Director of Environmental Services for Strong Memorial Hospital. So I think Dr. Apostolakis might talk for just a minute or two, then we'll do questions. And in our news conference format, we'll do one question and a follow-up just in the order that they appear on the Zoom screen. So, Dr. Apostolakis?
Yes. I'm Mike Apostolakis, Chief Medical Officer for the University of Rochester Medical Center. Thank you for this opportunity. As Chief Medical Officer, it's my primary responsibility to make sure that not only all our patients are safe and get high-quality care, but it's my responsibility to assure that all our faculty, staff, and anyone that helps us care for our patients is safe during that care. We've received some questions today, particularly about our environmental services workers. Those workers are especially important at this time, helping us care for our patients infected with COVID and our patients not infected with COVID. Their important work, cleaning and disinfecting rooms, preventing patients from getting infected, preventing staff from getting infected, and preventing themselves from getting infected, is vital to what we're doing. We can't take care of patients without our staff. Our staff need to be safe, and they need to feel safe. To that end, and because there's a lot of confusion about PPE, we developed this chart that you can see on the screen that lets our faculty, staff, and all our workers here know what PPE they should be using. You can see that the PPE is listed here: masks, eye shields, and gowns, and whether to be used, which ones to use outside of patient care, in non-COVID patients, in COVID patients. Are you able to wear in between patients? Do you clean after use? And how do you do central disinfecting if it's appropriate? You can see there's many different categories and types of PPE, and it's not surprising to hear that there is some confusion about what's appropriate, but I assure you our recommendations for all of our faculty and staff meet current guidelines and keep our workers safe. I can tell you that we have data that tells us that if our workers, faculty, and staff use the PPE that we've recommended on this chart, we have no identified infections of COVID in those faculty, staff, or workers. With that, I'd like to stop and now answer questions that you have.
Okay, I'm sorry, I'm not seeing names here. We've got Spectrum News is first, so whoever's on from Spectrum, if you just please tell us your name and then ask us your question.
From Spectrum, can you hear me all right?
Yep.
Can you turn it up?
I guess,
Volume.
what you say now? When it comes to the PPE equipment, I know at one point the whole state was talking about the issue of just supplies. What would you say, what are your supplies looking like so far? Do you feel as though you have enough to make it through? And if so, how many days or weeks would you say? So
we get updated every day about our supplies. Right now we have our load is about approximately 2 weeks for some supplies, and as much as a month and a half for other supplies. So somewhere between 2 weeks and a month and a half, 2 to 6 weeks. And we're getting regular shipment of those supplies.
And are your supplies dependent on private contractors, or are you also depending on the county and the state in the event that you need more items?
We've used all those sources to date, but mainly it's private contractors.
Thank you. And who's on from WHAM? Is that WHAM Radio or 13 WHAM?
This is 13 WHAM. This is Tyler Brown.
Oh, hey, Tyler.
Hi. My question is, when it comes to the equipment, how much PPE do you guys go through on a given day or week through this whole crisis?
Well, that's there's many different items of PPE. There's masks, there's gowns, there's gloves, there's shields. So the shields are reusable. We've probably handed out well over 10,000 shields. We go through a neighborhood of probably 15 to 20,000 surgical masks a day. We go through N95 masks at a different pace because those are the ones we're able to disinfect and reuse. So we've been going through less N95 masks. And let's see, I think I hit all of the major PPE. The gowns are, I can't tell you exactly how many we go through. Those are on shortest supply. We have about 2 weeks of those, and we're working aggressively to get more gowns.
And Tyler, before your follow-up, the PR guy is going to make a story pitch here. The one reason we have a good supply of shields is that the orthotics lab in the Department of Orthopedics is actually, they came up with a design and are manufacturing, I think, thousands of shields per week. So we're well supplied in shields thanks to our own ingenuity in the Department of Orthopedics. But we'll save that for another day, and Tyler, you can ask your follow-up. Tyler, we're not hearing you. Unmute, William.
All right, hello, can you hear me now?
Yeah, sorry about that.
No problem, no problem. Are there any one of those items that can see in the future you guys could be having a short supply of in the coming month or so?
The one we're most worried about at this time is gowns, and we're looking to source actually reusable gowns. In the past, we used to have cloth gowns that work just as well, but we need to get them cleaned and serviced. So we're looking at that as well as many different sources of gowns.
All right, next, WROC News Channel 8.
Hey, this is Jack Watson from Channel 8. Dr. Apostolakis, thanks for talking with us today. My question is, if the environmental services workers are working in the same rooms as the doctors and nurses, why do they require less protection, less equipment?
They don't require. They require the exact same protection nurses do. I think what you may be referring to is the fact, and when you look at our PPE requirement, the nurses would wear the exact same PPE as an environmental services worker does, except the nurse could be doing a aerosolizing procedure, like suctioning the patient. During an aerosolizing procedure, an N95 mask is required. However, when there's no aerosolizing procedure, the nurse will wear a standard surgical mask when in with a COVID patient.
So one concerned viewer that we spoke with earlier today said that he was a worker in the environmental services department and he was only given a surgical mask and some gloves. Do you think is that adequate enough protection to protect against COVID-19 for somebody that's sanitizing and cleaning it?
In a COVID-19 room or in a non-COVID-19?
It's
in a COVID room.
The glass table looks like a split screen.
Yeah. So are you talking, is the patient in the room or not in the room?
Patient not in the room.
So the patient not in the room, there should be no reason why the environmental services worker would never need to wear a gown. They should wear a mask and gloves. And however, if that person felt uncomfortable, we would allow the use of a gown. The real reason to wear a gown and eye cover is when a patient's in the room and they could cough and expectorate on someone, get in their eyes or on their body. If there's no patient in the room, there's no reason to believe that any expectorant would get on the body or in the eyes. So in that case, a mask and gloves should be sufficient.
And
Thank you, sir.
Next, I think Brett Dahlberg from WSXI Radio.
I'm looking at the chart that you shared, the when to discard column. It looks to me like gowns and gloves are the only things that get discarded after each patient. Does that mean that surgical or procedure masks are being reused patient to patient through the day?
So assuming, so you can see, can we go back to the chart? Okay, you can see at the bottom is all masks must be worn with COVID plus PUI patients, must be covered by a face shield in order to reuse. So if you're in the room with a COVID patient or a PUI and you have a mask on and you don't have it covered by a shield, then you must discard it. If, however, you're wearing a shield as we recommend, it's covering and protecting the mask, nothing should get on the mask can be used between patients. The shield is then cleaned between patients.
Brett, did you have a follow-up? Brett Dahlberg, muted. Sorry, Brett, did you have a follow-up?
Yeah, thanks. What I'm remembering from a previous press conference where we touched on personal protective equipment was that you'd said, I think Dr. Apostolakis, that only N95 masks would be sanitized and reused multiple days. Is that still the case, or is any other PPE being sanitized and reused?
No other PPE is being sanitized and reused. I can tell you that the mask I'm wearing today is the same one I've worn all week. So I've been up on the floors. I haven't been in patient rooms, but I feel safe in this mask. It's not soiled. It's not wet. So we are reusing standard masks if they're not soiled or wet. The only PPE that we're disinfecting is our N95 masks, and I'm sorry, the shields we are cleaning in between patients with cavi wipes.
All right, thank you, Brett. And Will Cleveland from the Democrat and Chronicle. Sorry, Will, we're trying to find you to unmute.
Can you guys hear me okay?
Yeah, there you go.
Perfect, thank you. First of all, thank you for taking a few moments to talk with us, Dr. Apostolakis. We appreciate it. You were saying that if PPE had been used, you hadn't been able to identify any infection. So we're interested in how many staff have gotten infected, and if you could specify by division, and if it's because of improper use of PPE that these people have become infected.
Yeah. We are not releasing the numbers of our staff that have been infected. We are watching that closely. What I can tell you is that any staff that have been infected, it's not been found in anyone who's followed the PPE as described on this chart. Now, there have been infections caused by earlier in this epidemic where we didn't realize a patient was infected, that staff were doing as we had asked, but no one realized the person was infected and our staff became infected. That's true. But since we've developed this PPE chart that we have here and staff have followed it, any staff who have followed this PPE, we have no documented infections.
Do you have a follow-up, Will?
I do. And so when did the chart come into place? And then so you're saying since this chart has been distributed, then you said you haven't seen any documented cases.
Yeah, so that's a good question. Let me clarify that. We've had these recommendations for some time, likely over the last few weeks. We actually put the chart together because we had so many different questions that the chart has only been in existence probably for a week or so, but the elements of the chart have been in place for, the elements of the chart have been in place for 3 weeks or so. And since we've made these recommendations, we've had no infected staff who followed these guidelines.
Thank you.
Okay, and next, Kayla Green, are you there?
So Channel 8 gets 2 questions then?
Oh, no, sorry. This is a difficult list.
No problem.
And WHEC Channel 10, I don't think we've heard from Channel 10 yet. Channel 10 is unmuted. Anyone else from, well, I see Minority Reporter, that's Patty Singer. We'll let Patty ask a question, and if someone from Channel 10 wants to text me or actually use the chat function here and just tell us who's on from Channel 10. Patty Singer?
Hi. I just want to be clear from the chart that an environmental service worker would be somebody who's cleaning, housekeeping, or perhaps bringing up a meal or anything like that. That person would have the exact same equipment as a medical person would, handling the same classification of patient.
Yes, I can attest to that. That those staff members would have that same type of equipment available to them, the PPE, and there's no questions about it. It's provided for them.
Okay, so how difficult is it to clean these rooms between patients? We know something like C. diff is incredibly difficult to eradicate in a room, and could also put environmental service person at work. Comparing a COVID and a C. diff, how much risk is the person at of picking up this contaminant?
The way the room is cleaned, it's cleaned the same way. The staff recognize the risks, and they very meticulously clean the room, and it takes about maybe 40 minutes or so to actually give a good detailed clean.
Okay, thank you, Patty. Get anything in chat? Okay. I'm going to unmute everybody just so I want to make sure we're not leaving anybody out. Yeah, we're going to unmute all participants. If I have left anyone out, will you please speak up?
Did you get, I'm from News 10 NBC. I had asked a question before. I don't know if you guys heard it.
No, I'm sorry. I think we missed that.
That's okay. Yeah, I guess the mic was having problems. Andrew Hyman from NBC, by the way, WROC. Thanks again for taking our questions. Just to follow up on this environmental services. So we spoke with a similar concerned employee who said that the majority of workers felt uncomfortable with the availability of masks. You had said that you would provide an N95 or face shield or someone who did feel uncomfortable. If there were more than 1 or 2 employees, do you feel you'd have an adequate amount of these masks and face shields to provide?
Well, the amount of PPE is directly proportional our need to social distancing and how many patients we have. Certain PPE is more valuable than other PPE. Because of concerns of aerosolization, we've gone above and beyond by allowing those who are in rooms where aerosolization occurs in non-COVID patients to wear N95 masks. We haven't gone so far as to say that everyone who's uncomfortable can wear an N95 mask anytime they wish. I don't believe that we or any other institution has enough N95 masks to do that. That simply hasn't been shown to be effective and would use a valuable resource with no suggested benefit. We have gone to universal masking because of concerns of asymptomatic patients and asymptomatic staff for that matter. And that's why, I and everybody in the institution is wearing this mask. And we believe this provides adequate protection for almost every situation except aerosolization. And I'll go back to my statement that with the recommendations we've put in place, we haven't had any of our faculty or staff infected if they use the PPE the way that we've been recommending.
You have a follow-up, Andrew? Are we still unmuted? He's unmuted. Follow-up question?
No, thank you.
Okay, thank you. I think we have hit all the media outlets. If not, please shout out now when everyone's unmuted. One additional point that I don't think came up is a lot of what Dr. Apostolakis and Harvey have been talking about is the cleaning of patient rooms. Remember that we are a large academic medical center, I think about 1 million square feet, so we have many employees that work in office areas, education areas, or research areas separate from clinical care. And in many of those areas, like me, we just wear a surgical mask for our PPE. So I think with that, we'll thank you all for being available on short notice.
Chip, one thing, can we get the spelling again in the title of the other gentleman?
Sure, I think the easy way to do that is right now, and he's going to correct me if I'm wrong, but it's Harvey, Harvey, Gamble, like Las Vegas, Gamble, and Director of Environmental Services for Strong Memorial Hospital. Yeah, yes, not for the whole, yeah, or for the medical center.
For the medical center?
No, for Strong Memorial Hospital.
Okay, all right. Thank you.
Thank you. All right, thanks everybody.
Thank you.
Thanks, gentlemen. We appreciate it.